Honorable Edward Sekandi, Vice President of the Republic of Uganda, Honorable Minister of Health, Sarah Pendi, Your Excellencies, the ambassadors, the ministry dignitaries, development partners, district and religious leaders, the Board of Directors, Mildmay Uganda, our friends and partners from other Mildmay institutions in the UK and in Kenya, our dear community, the media fraternity, distinguished guests, ladies and gentlemen, the management of Mildmay Uganda is excited to host you here today. Your Excellency, we warmly welcome you to Mildmay Uganda. Mildmay Uganda is a center of excellence, but more specifically, we are grateful that you have come to launch our master plan, a master plan that will see Mildmay Uganda evolve into a modern teaching hospital. We are humbled that in your busy schedule, you have found it important to be here. Thank you very much. Your Excellency, through you, we would like to extend our sincere appreciation to His Excellency, the President of Uganda, General Yoweri Kaguta Museveni, the patron of Mildmay Uganda, for his and his government's commitment to health and health improvement, but more so for the support for this institution. We continually celebrate his sustained passion for Mildmay Uganda, demonstrated in our inception and throughout the milestones of our growth. Mildmay Uganda envisions a community equipped with the knowledge and skills to address HIV, to elimination, and other national health priorities through service delivery, education, research, and we are inspired that he is a part of our story. Through you, we would like to extend again our thanks to His Excellency, the President, and the Government of Uganda for the invaluable opportunity that we find to consolidate the gains of our work in an environment of stability. Thank you very much. Your Excellency, the Vice President, the President of this country recently launched the fast-track initiative to end HIV and AIDS in Uganda. Mildmay Uganda is inspired by his commitment and will continue to support all the initiatives under his leadership in partnership with the Ministry of Health and other partners, with a special focus on reaching men, adolescents, and young women. And our faith is unwavered that we will see the end of HIV. Your Excellency, in 1998, on the personal invitation of His Excellency General Yoweri Kaguta Museveni, and with full support of the government of Uganda, that donated the land for the first Mildmay project in Uganda, Mildmay opened its gates to the public for comprehensive HIV care with a special focus on children. By the time we came to 2004, we had over 3,000 children waiting for those life-saving pills, and PEPFAR did come in to support. We draw inspiration from the many children and their families that have trusted us these 18 years to do a good job. From that seed that was planted way back through the conversations that took place in 1996 through to 1998. Today, Mildmay Uganda supports care for over 100,000 people in many districts in this country, and 7,000 of them are children. Your Excellency, the Malme Uganda Hospital was built as a tertiary referral HIV outpatient care facility, initially to support a little over 3,000 clients. Today we have maintained for the last 6 years between 12,000 and 14,000 clients accessing care here in Lueza. Your Excellency, since 2014, all children born to HIV-positive women at the Malme Uganda Hospital have been born and have remained HIV negative, and we have supported and worked with the districts to partner to bring down the mother-to-child transmission rate from an average of greater than 19% in 2012 to an average of 3% to date, with the support of the Ministry of Health, our partners, particularly PEPFAR, and our district partners. We are grateful for this support, but also particularly through you want to extend our thanks to Honorable Janet Kataha Museveni, our First Lady, and Minister of Education and Sport for championing the elimination of mother-to-child transmission agenda. Your Excellency, getting men into care is a big focus for us as a country today. Malme Uganda is at the front of that fight, as we always have been. We have registered significant successes in promoting male involvement, Your Excellency, and I'm excited that you're here today, even to join us and to encourage through the words that you speak to us, but also through the gentlemen who have come here today, that we need to get more men and more men into care as per the President's Fast Track Initiative program. Through our EMTCT, or Elimination of Mother-to-Child Transmission programs, male networks at male-dominated workplaces like building sites, border stages, we have supported male testing. We have encouraged male leaders. As you have heard, some of our champions have been the LC, like the LC1 chairman, Mr. Chijongolo, pointed out, to sensitize their communities to come for testing. And we have registered great successes. Strategically, we have placed male nurses in antenatal clinics to attract men into care. We have prioritized couples counseling. We have given results on the same day as is guided by the Ministry of Health. And we have promoted male champions. And Malme Uganda has registered successes. Your Excellency, today we recommit to that fight. And when you come back, you will collect on that promise. We have partnered with CDC, PEPFAR through CDC, and we're grateful to the American people for the support that they have provided for the care of our patients. Ministry of Health has walked this journey with us, and we are grateful for that support. The National Health Laboratory System has particularly been a Malme partner, and we've worked with them to grow over 223 laboratories in this country and support the improvement of diagnosis, monitoring of HIV disease in the context of a health system. With the support from our partners, the Ministry of Health, the Malme Uganda Laboratory is currently the backup system for the National Health Laboratories for viral load and early infant diagnosis. And we also support the data management systems for the national system. We are inspired, Your Excellency, by the commitment of our partners, notably PEPFAR and CDC, which have funded the bulk of our HIV care for over 14 years now. And yet there's still many organizations and individuals that have continued to trust us with their resources. And this is our opportunity to thank you all. We thank you. Working with the Ministry of Health and the districts, Your Excellency, Malme Uganda averts an estimated 7,000 new infections every year through comprehensive prevention, care, and treatment services. Our pledge, Your Excellency, is that we will continue to build on this work. And yet, Your Excellency, there is still a lot more that has to be done. This function is about Mildmay Uganda rising to the challenge to respond to the needs of our country by doing some more. Since 1998, we have kept adapting our programs, responding to the needs of the people that we serve. And Mildmay's task today is to demonstrate another milestone in that change process. In 1998, on the invitation of the President, Mildmay's task was to model HIV treatment systems and scale up this care like Mildmay was providing in the UK. Mildmay, Your Excellency, has done that. In 2009, Mildmay International handed the mantle to Mildmay Uganda, a local NGO. And we have since evolved into a technical hub, working with the Ministry of Health and partners, providing quality comprehensive healthcare services, including adult and pediatric medical consultations, surgery, Your Excellency. We provide psychosocial and behavioral support to our community and the clients in particular that walk through our doors, rehabilitation, nutritional support, physiotherapy, occupational therapy, eye care, psychiatric or mental health disease care, laboratory and radiology diagnostics, dental care, obstetrics and gynecology, adolescent sexual and reproductive health, adult and pediatric palliative care, and care for the elderly and social welfare. Your Excellency, we will continue to provide these services. Initially, we provided this service just for people living with HIV, but we're working in a community that needs more than HIV and AIDS care. We extended it to their families, as is our model, to deliver a family-centered, multidisciplinary approach to care. But now, our gates are open to the general public, and we are answering to the call of the President, the Ministry of Health, to respond to the needs of the people of Uganda. We are excited, Your Excellency. Delivering a family-centered care package has helped us meet many needs, as we hope the community can testify. Today, hypertension, diabetes, malnutrition, asthma, anything that is called disease can walk through these doors and will get a helping hand. We have partnered with the Ministry of Health, Mulago Referral Hospital, the hospitals around, Wachiso District in particular, and we will continue to grow our service as you have asked us to. Mildmay Uganda, Your Excellency, is accredited by the National Council of Higher Education. It is accredited by the Uganda Allied Health Board. It is also accredited by the Uganda National Council for Science and Technology, among many accreditations, and delivers up to 12 academic programs, including a Bachelor of Science in Health and Social Health Systems Management with University of Manchester. We deliver Bachelor of Science and Diploma in Human Nutrition and Clinical Dietetics with UCU, a Diploma in Medical Laboratory Technology, and we have registered up to 3 cohorts, which Your Excellency, you have heard, is doing very, very well. We have a Diploma in Medical Records and Health Informatics. We have a Diploma in Clinical Medicine and Community Health. Your Excellency, our assurance to you is that the products of our training and education programs will make you proud to be associated with this institution. The Mildmay Uganda 30-year plan, Your Excellency, that you will launch today will build on this rich knowledge and experience base to guide our evolution into a sustainable, local, private, not-for-profit teaching hospital that plays a pivotal role in Ugandan's transition to a middle-income status. The 30-year master plan will equip us institutionally for a greater role in ending the HIV epidemic, increasing access to the utilization of healthcare, and filling critical human resource gaps at lower health facilities by a rich skills-based training of paramedics as a start, and with a vision to grow the institution to the full potential as a medical university. Your Excellency, we have been told by some that this growth vision is ambitious. At Mildmay, Uganda, we call it a unique, undying quest to be better and to contribute to the betterment of those around us. We are inspired by the knowledge that way back when stigma was rife on the continent and beyond, where Mildmay began in the UK, Mildmay stood to be counted, and today the world is talking about a possible end to HIV. Your Excellency, therefore, our vision is reachable, our responsibility is clear. We will reposition ourselves. We will make ready to contribute to the critical health and development priorities that face our country. Our belief is that we have a great asset in the patronage of our President. His leadership drew Mildmay International to Uganda back then. We can rely on him for strategic partnerships that will propel us forward. But also, we have many friends, including you, and a $33.8 million plan is certainly feasible. We have walked a long way with many of the people who have come here today. Some of them are partners, Your Excellency, that have resourced the work that His Excellency asked us to do. Others are those that have encouraged us. Many former staff of Mildmay Uganda, through all the transitions in the last 18 years. Many here have been beneficiaries of our care and training programs. Your Excellency, kindly allow me to mention to you some of our partners and the friends and people that have enabled Mildmay Uganda to live the dream that His Excellency, the patron, the President of Uganda, had many years ago. The Ministry of Health, Your Excellency, the Ministry of Education and Sports, the Ministry of Gender, Labor and Social Development, government professionals and regulatory councils and departments, the U.S. Centers for Disease Control and Prevention, many donors, Your Excellency, the list is long, fellow HIV implementing partner organizations, the districts and their leadership, the Mildmay Uganda Board, Mildmay staff, current and former, staff in the UK and in Kenya, volunteers and students, our service providers in the business, community and private sector. Your Excellency, the local community has been very supportive. Our clients, particularly the children, whose lives have taught us many things about the value of giving. We are grateful, Your Excellency, and we ask that you kindly thank those people and groups of people for us. Your Excellency, before you is a great crowd of witnesses that God has been faithful to Mildmay Uganda, and we are confident that He will do it again and again. Thank you for honoring our invitation and launching us into the new dispensation that will see Mildmay Uganda evolve into a modern, not-for-profit teaching hospital that responds to national health and development priorities. We look forward to hosting you on another occasion and another occasion at Mildmay Uganda for God and my country.